What even is albinism? Albinism is an inherited condition that leads to someone having very light skin, hair, and eyes. It happens because they have less melanin than usual in their body. Melanin gives skin, hair, and eyes their color. Except for vision problems, most people with albinism are just as healthy as anyone else. I present to you the people with albinism. History of the disease. The OCA2 mutation, which is responsible for the majority of albinism cases in Africa, is likely the earliest mutation that causes albinism and is thought to have arisen in Africa during mankind's history. It's still there for some reason. Who discovered it when it was discovered? Sir Archibald Garrett, a British physician, proposed in 1908 that inherited illnesses like alkaptonuria and albinism are caused by reduced activity or complete lack of enzymes engaged in specific biochemical pathways. Garrett's classification and identification of inborn metabolic defects was a major conceptual breakthrough in medical genetics in the 20th century. Now I present to you Mr. Archibald Garrett. Identify the disease. Albinism is a genetic disorder in which the production of melanin, the pigment that gives color to your skin and hair, is reduced, resulting in a fair skin tone, light eyes and hair, and higher vulnerability to many skin and eye conditions. Melanin is the pigment responsible for the color of your skin and hair. It can be found in the epidermis, the outer layer of the skin, the hair, and the eyes. Melanin serves to protect your body from the sun's ultraviolet UV rays, which help to prevent skin damage and cancer. There are two types of melanin: eumelanin, a dark pigment that causes brown to black pigmentation. Another kind of melanin is pheomelanin, which is responsible for the pigmentation of the skin. What are its symptoms? Skin that is pale, blonde, brown, or reddish hair that is very light. Pink, pale blue, green, gray, or light brown eyes are common. Those who have light, sensitive eyes. A sluggish eye called strabismus. The eyes move back and forth, back and forth, back and forth, back and forth, called nystagmus. Issues with vision. How is it diagnosed? Albinism is frequently visible in babies. It can be confirmed with a genetic test. Your doctor will most likely compare your baby's skin and hair to that of relatives. To check for vision difficulties associated to albinism, an eye doctor or ophthalmologist may do an electroretinography test. What are the medications for cure and treatment of symptoms? No effective medical treatment of albinism is currently available. Nitisinone, which is approved by the U.S. Food and Drug Administration (FDA) for treating hereditary tyrosinemia type 1, elevates plasma tyrosine levels and increases eye and hair pigmentation. Nitisinone may soon be a potential treatment for people with ocular albinism. How is it managed? Albinism cannot be healed because it is a genetic illness. The focus of treatment is on receiving good eye care and keeping an eye on the skin for signs of irregularities. Your primary care physician may be joined by specialists in eye care, ophthalmologists, skin care, dermatologists, and genetics. What is its prognosis? Albino persons have a normal life expectancy and suffer from the same medical issues as the rest of the population. Although the risk of skin cancer is raised, it is usually treatable with close surveillance and quick treatment. How prevalent is the disease? Oculocutaneous albinism affects about 1 out of every 2,000 people on the planet. People with various ethnic groups and geographical places are affected by the disease. The most prevalent varieties of this syndrome are types 1 and 2, while types 3 and 4 are less common. Present a statistic of the prevalence of the disease according to age group, race, gender, etc. Prevalence of the disease according to age group. The global incidence of albinism is 20,000 people with a low rate among patients between the ages of 21 and 30. Prevalence of the disease according to gender. Mutations in the GPR143 gene are the most common cause of ocular albinism type 1. The disease is inherited as an X-linked recessive trait in these situations. Males are more likely than females to be afflicted because males only have one X chromosome. They only have one copy of the GPR143 gene. Prevalence of the disease according to race. The most common kind of albinism is OCA2, which is more common in the African Americans and Africans. The estimated frequency in African Americans is 1 case per 10,000 people, while it is 1 case every 36,000 people in whites. Across all races, the total frequency is 1 case per 15,000 people. What are the researches conducted about the disease? Mention 1 and give a brief discussion. A small pilot clinical study at the National Eye Institute (NEI) suggested that the drug nitisinone increases melanin production in some people with oculocutaneous albinism type 1b, COA1b, a rare genetic disease that causes pale skin and hair and poor vision. What makes this disease unique? Albinism is unique because it's an uncommon set of hereditary illnesses characterized by a lack of color in the skin, hair, or eyes. Vision difficulties are also linked to albinism. According to the National Organization for Albinism and Hypopigmentation, albinism affects around 1 in every 18,000 to 20,000 people in the United States. How can you apply your knowledge on the DNA and heredity to lower the chances of individuals having offsprings with the said genetic disease? Even though I have a lot of knowledge on this disease, I cannot help them lower the chances of having offsprings with albinism because it cannot be prevented because albinism is an inherited genetic condition, not a disease. Hence, it cannot be prevented. Albinism can be detected in a fetus through genetic testing. Amniocentesis is conducted between 16 and 18 weeks of pregnancy. As a geneticist researcher, do you have any suggestions on the management of the disease? The focus of treatment is on receiving good eye care and keeping an eye on the skin for signs of irregularities. Your primary care physician may be joined by specialists in eye care, ophthalmologists, skincare, dermatologists, and genetics. Thank you so much for watching my video. I hope you enjoy and learn something new, and I will see you again next time. Bye bye.